outside is the fibrous capsule. So in order to kind of identify asking for that versus asking for the kidney, if we put a pin in the outside of the kidney, there are two things that we could be asking for: the fibrous capsule or the kidney itself. If we're asking for the organ, we're asking for the kidney. If we're asking for the fibrous capsule, we'll be asking for either the structure or the layer. Okay, structure or layer for that one. So if we look at our slide, we have one. This is a bisection of a kidney, so this is the kidney cut in half. Right here, this outer layer, kind of a little bit darker. It's kind of hard to see, I think, but that's going to be the fibrous capsule. Again, once you see it, it's just the outer coating. It'll be pretty easy to identify. All right, next, the hilus. You're actually going to be able to identify the hilus before opening up the kidney also, so make sure you do that. The hilus is going to be this region here where the ureter is leaving the kidney. It's also where you're going to find the renal artery and vein. So before you even open up the kidney, you should be able to identify the hilus, the fibrous capsule, the renal vein, the renal artery, and the ureter. So find all of those things first, okay? And again, you know the ureter is what's leaving it. For the hilus, if we're asking for the hilus, we're going to ask it in a closed kidney. So it's going to be a completely intact kidney, or at least a closed kidney, not an open view. And we'll put in the outside area right here, right where the ureter is leaving. All right, that's how we'll identify it. Now, if it's an open view like this, the things that we could be asking you for are first the cortex, which is the lighter colored outer layer, and you will actually see a nice color change like this. The next inner layer is going to be the medulla, which will be slightly darker. And then in the center, you'll have the renal pelvis, and the pelvis will be a nice white color like this. And those are the three things we're going to be asking you on this surface, on that bisected surface. All right, I'm going to move to a different view to talk about the last two. So any questions for the kidney before we move on to the next view? Okay, it's all, oh yes.
So the the pelvis is that white part?
Mm-hmm. So this is a pretty established renal pelvis. You may find it's a lot smaller in your cat, but you'll be able to tell that it's the renal pelvis because of that color change. That'll be the biggest thing that gives it away.
And then the number 5, what it's on, is actually the what is it?
This would be the calyx, but
Calyx, right?
You're not asked for that.
Okay.
So you just.
But that's what it's on.
That is what it's
number
on.
5.
Correct.
Okay.
Yeah. So this is kind of, and we also you can see the pyramids and the columns in here too, which are really nice. But we're not going to be asking for that level of detail in the kidney. It's just cortex, medulla, and pelvis for the dissection. It's pretty basic. Any other questions?
Where's the renal artery and?
Those would be coming out of here. They're not shown here. Yeah, good question too. Those are going to be coming out right here, so you don't see them here, but when you actually find the kidney, you'll see that there are veins and arteries attached to it going towards the center of the cat's body. Those will be the renal arteries and veins, and just like all the other vessels in the systemic system of the cat dissection, the red ones will be the arteries, the blue ones will be the veins. Okay. Any other questions?